I'm Dr. Bill here for a Sneez Medical Minute on ear infections. Ear infections are incredibly common in young children, and many times parents ask, why is my child getting so many ear infections? Well, first I want to explain the anatomy of why it happens so easily in small children and why it's much less common in teens and adults. The reason is this: the inside part of the ear, behind the eardrum, deep inside, bathes in fluid all the time that the inside part of the ear makes, and then there's a tiny tube that drains that out to the back of the nose and throat area. Just kind of like the drain on your sink pipe, taking that away. On adults, that tube is fairly angled from the ear high, low to where the mouth and throat and nose are. In little tiny children, especially infants, it's fairly flat. So that means it doesn't drain very well. So here's what happens. When a child gets a cold up here, that nose and throat area gets congested, the tissue is swollen microscopically, there's more fluid production, and so what that means happens is it clogs up the draining of that fairly flat horizontal draining pipe from the inside of the ear, which then means it doesn't drain very well, so fluid begins to build up behind the eardrum, and then germs from the nose and throat area decide to walk up this slow-moving stream very easily, set up camp behind the eardrum, and have a big party. And that creates the ear infection. Now, what do you do for ear infections? Well, ear infections can actually be viral or they can be bacterial. And here's the problem for us on the doctor side. You can't tell by looking which one it is. Viral ones go away on their own. Bacterial ones go away much more quickly if a baby is given antibiotics. So what do we do with that? Well, there are a couple different things that can happen. If it's viral and a child is old enough, let's say 3, 4, 5, 6, you don't know, only by waiting can you find out whether it's viral. So what I mean by that is you come in, the doctor looks in the ear, says you have a red bulging eardrum. If a child is 4 or 5 and can talk, you may say, why don't we wait 2 or 3 days, give our child Tylenol or Motrin, and then we'll see if they still have pain and complaints in a couple of days. That's a very common standard course of treatment. Now, if it's a tiny child, a 6-month-old, a 1-year-old, 1.5-year-old, our reaction on the doctor side is to tend to give antibiotics because the risk and concern of not treating a bacterial infection in a tiny child is greater. So those kids do get more antibiotics in that context. Some children just get lots of ear infections. Maybe it's their anatomy, maybe they get more colds, who knows why, and a few of them need to have what are called tubes put in their ears, which essentially is a tiny little, looks like a spool of thread, an empty spool of thread that goes on both sides of the eardrum to allow air to get in there to keep that fluid from building up. It can be very helpful for the children that have chronic ear infections. It's a tough situation. Most kids outgrow ear infections by the time they hit 3, 4, 5. They become much less common. They are very common less than 2. Hard to know because the symptoms often in a child less than a 2-year-old are the same symptoms for everything. Fussiness, fever, not sleeping, not eating. That's true for almost all illnesses. That's why you tend to have a lot of doctor visits in those first 2 years. I'm Dr. Bill. That's your Medical Minute on ear infections.